Sometimes newborns cry and you do not know the reason. One of the reasons why newborn cry is because of the discomfort from trapped gas. Hi everyone, welcome to my channel. In this video, I'm going to be talking about 5 ways to burp your baby and help your baby get rid of trapped gas. My name is Olufumi Odumuagun. I am a mom and I am passionate about homemaking, and I share different types of homemaking content. So why do we need to burp our babies? Most times for newborns, while sucking on the bottle or on the breast, they take in trapped gas, which causes discomfort and pain for them and makes them to cry. Sometimes newborns cry and you do not know the reason. One of the reasons why newborn cry is because of the discomfort from trapped gas. So I'm going to be showing us 5 ways to help get rid of this trapped gas. And the first method is on the shoulder method. For this method, you want to start by placing a bib or a towel on your shoulder so that if your baby spills out milk during this process, you have something to catch it. And then you place your baby on the shoulder in such a way that allows the baby's belly to rest on your shoulder. This puts some pressure on their belly while you gently pat their back and rub their back occasionally during the process. You can do this for 1 to 2 minutes or until the baby burps. I would recommend that you burp your baby when switching from one breast to the other during breastfeeding. I will also recommend for bottle-fed babies that you burp them halfway into the feed, then after the feed, you also burp for both breastfed and bottle-fed babies. Another modification of the on-shoulder method is placing them in such a way that their belly is resting on your breast. The protrusion of the breast puts some pressure on the belly, and you can gently pat the baby's back in such a way that brings out the gas. Make sure that while patting the baby's back, you do it in such a way that you can hear a thumping sound, but it's not harsh enough to cause any discomfort to the baby. You can also rub the baby's back during this position. The second method I will share is the on the lap method, and in this method you sit your baby on the lap while supporting their neck with your hands using your thumb and your index finger. In this manner, you allow your baby to lean forward while supporting them with your hand, and then you gently also pat their back and rub their back while in this position. The third position is a modification of the on the lap position, in which you place the baby in the lying position. So it's the lying on the lap position, and you support your baby's neck also in this position, just like the on the lap position, while allowing them to be in the lying position. So while in this position, your hand creates a support for their neck while also putting some pressure on their belly. While also in this position, you can gently rub their back and pat their back until they have burped. It is also important to mention that in whatever burping position that you take, make sure that your baby's nose is not obstructed. Make sure that they can breathe properly and they are not uncomfortable. The fourth position I'll be sharing is the tummy time position, and in this position, I'll recommend that you do not do it in between feeds like I mentioned for the first 3 positions. I recommend that you do this after feeding and you still see that your baby is showing signs of discomfort or showing signs that they have trapped gas. So in this position, you place them in tummy time position, making sure that their nose is not obstructed but they are lying on their belly. Then you can gently pat their back in this position. It is important to note that babies generally do not like the tummy time position, and you do not want to stay in this position for too long. So you can do this for up to 2 minutes, or when your baby starts to show signs of discomfort and they can't take it anymore, then you have to remove them from this position and try any other position that you want to try. The fifth position is the bicycle position, which involves lying your baby on their back and gently making bicycle motions with their leg. These motions helps to put some sort of pressure on the baby's belly and helps them to expel gas. Another modification of this method is to just push the baby's legs in such a way that it puts some sort of pressure on the abdomen. These 5 methods will help your baby to relieve gas easily. However, if you have tried all of this and your baby still shows so much signs of discomfort caused by trapped gas, you might want to speak with your healthcare provider and have them recommend a drug that might also help. I would advise that you do not do self-medications for newborns because they are really delicate and you should see a doctor each time you want to give them any medication. If you have learned one thing or the other from this video, kindly like the video, subscribe to my channel and share with your friends. And once again, congratulations on the birth of your newborn and have an amazing time. Bye.